You're listening to the Birth Matters Podcast, episode 115.
Because I took your class and because I learned through that there is another way and there are a plethora of options and information out there that you have to take your own experience into your own hands. Like, you are the one birthing here, not them. And so I think that really helped me at that moment to say, this isn't how I want it to go. And I do want to wait. This is something that is important to me. And if it's important to me, then I have to say something about it.
Hey there, and welcome to the Birth Matters Show. I'm your host, Lisa Graves Taylor, founder of Birth Matters NYC and director of East River Doula Collective. I'm a childbirth educator, birth doula, and lactation counselor, and I've been passionately supporting growing families since 2009. This show is here to lessen your overwhelm on the journey into parenthood by equipping and encouraging you with current, best evidence info and soulful interviews with parents and birth pros. Please keep in mind the information on this show is not intended as medical advice or to diagnose or treat any medical conditions. Are you following us on Instagram yet? We have lots of educational content there, so connect with us over at Birth Matters NYC. Now for a little bit about today's story. Tracy's second pregnancy surprises her by being much more challenging than the first. Toward the end of pregnancy, baby number 2 is persistently transverse or sideways, and her OB recommends manually turning the baby. Tracy isn't fond of that idea, so she does some research and goes to a chiropractor who specializes in helping with this using the Webster technique. Baby successfully flips, and Tracy is able to have the vaginal birth she wanted. However, she needs to put the self-advocacy skills she learned in birth class to good use when the hospital staff starts pressuring her for interventions she doesn't want due to holiday overcrowding and not due to medical necessity. Now, a quick word from our sponsor. Today's episode is brought to you by the Birth Matters Complete online course. If you can't squeeze in an in-person group birth class series, or if you didn't feel like the one you took was comprehensive enough, or if you don't even have a quality class available in your area, I have a great option for you. The Birth Matters Complete course is an online, on-demand version of my live comprehensive series. It covers not only prep for an amazing birth with self-advocacy strategies, best current evidence, and tips for partners, but also holistic postpartum wellness, newborn feeding, which includes body feeding, pumping, and bottle feeding basics, and newborn care. And to top it off, you get lifetime access so that you can use it as a refresher later in this or future pregnancies. How awesome is that? You also have an option to add to the course a private, interactive, hands-on comfort measures coaching session, which is a really ideal option for the more tactile parts of the course. Check it out at birthmattersonline.com. All right, now let's hear from Tracy. Welcome to the Birth Matters podcast. Today, I have a former birth class student with me, Tracy. Hi, Tracy. Welcome to the show.
Hi, thanks for having me.
So Tracy is coming on the show to share her second baby's birth story mostly and some things about how the pregnancy went. Could you first please just introduce yourselves a little bit? Let us know who you are, maybe the area you live in, how long ago you gave birth to both of your little ones.
Yeah, my name is Tracy. I live in Flushing, Queens. I have 2 boys. My older boy, his name is Tyson. He was born 3 years ago, a week before New York City shut down. And my second son was born in December, mid-December. So he's about 4 months now. Yeah.
So you're still in the throes of it. You were sharing with me before we hit record that you're pretty tired, understandably.
Yeah, I mean, it's just sleep deprivation at its height. I mean, I think with a newborn, it's a little bit different because they fall right back asleep. As we're nearing the 4-month sleep regression, it's taking a lot more to wrangle him in and settle him down. It's a lot different than my firstborn for sure.
Yeah. And you were sharing how challenging it is to transition into life with 2 and juggling 2 little ones.
Yeah. I think so much of the emphasis is on going from no kids to one kid and how it's such a magical experience. And it's also, tiring. But then I think that there's not a whole lot of preparation that you hear about going from one kid to two kids, because I think that's what hit me really hard. The fact that you can't just hand them off to somebody, your partner or whoever, and just say, okay, I'm going to go take a nap now. Like with two kids, you're just on all the time. And I think maybe logically I knew that, but I just wasn't really truly prepared in my day to day and how exactly exhausting that was going to be and how split your attention is.
Yeah, there's this constant
Yeah.
tension. I know that
Yeah.
as a mom of two, and I feel you
Yeah.
there.
Yeah.
So, why don't we start with wherever you'd like to start in your second pregnancy? And as you want to work in your first experience giving birth, if you want to say anything about that, feel free to do that. But I'm especially interested to hear about your second pregnancy. And I understand that your baby was not in the most ideal position toward the end of pregnancy.
Yeah, to just give you some context, I really feel like with my second pregnancy, it's so weird because it feels like I was pregnant for the first time. With my first pregnancy, I feel like I could have ended up on the show. I didn't know I was pregnant. Like I was completely unaware until closer to the end of my first trimester.
Oh,
And
really?
yeah, I did not feel a thing. And throughout the entire pregnancy, it was smooth sailing, like as textbook as it can get. I felt like pregnancy is not a big deal. Like it's not really uncomfortable. I felt totally fine. I felt like my normal self. With my second, however, it was just as many things that are uncomfortable and that can go sideways during the pregnancy. I feel like I have experienced it during my second pregnancy. I had morning sickness, which I didn't know didn't just happen in the morning, because for me, it happened at night, like mostly at night. And so I was just like, what is happening to me? I thought it only happened in the morning.
It's such a misnomer. It totally is
I
a misnomer
know.
because most people, it can be all around the clock anytime.
I know. And for me, it only happened at night. So I was just like, what is happening with me right now? And so that happened first trimester. Second trimester, I had just had really terrible acid reflux, really bad heartburn. And the reason for this is because the position that he was in, at my 20-week anatomy scan, he was in the transverse position, literally on my stomach and like all my digestive organs. And I was just having the worst time. And people say your second trimester is where you go on a baby moon or you're feeling great. Like, I just felt terrible starting from that point on, because then he was really starting to pack on the weight. And that weight then in turn put itself on me and on all my organs. And I actually had a trip to the ER because at the same time that ER trip happened, I tested positive for COVID. So I thought I was short of breath because of COVID. So I ended up in the ER. Turns out it wasn't because I was short of breath. It was because my acid reflux was just so bad. Like he was just sitting just in the right position where I like could not catch my breath. And I'm a pretty small framed person. So there's not a whole lot of room he has to begin with. And so I think that, yeah, that trip to the ER was just, now thinking back on it, it's just like, wow, when you're pregnant, like all sorts of things can happen and you wind up at the ER because you're short of breath. Like, what? A baby can do this much damage?
Yeah. And especially
So,
like as early as 20 weeks, you wouldn't think that the baby's big enough to be causing mayhem like that.
no. Oh, no. And the entire time he was measuring like way bigger than his brother was to begin with. And so we thought he was going to be like a 9-pounder. But I think it's also just, it was a combination of things. It was his position, his weight. So all of that. So that was one of the first problems I ran into because of his transverse position. And then at that point on, my OB had me monitored through ultrasound every 4 weeks from there. And each time he was still in the transverse position, totally comfortable, not looking like he was going to move anytime soon. And by 35 weeks, my doctor was like, listen, you really should be starting to kind of considering whether or not you want to get an ECV. And so I don't remember what an ECV stands for exactly, but it's that procedure. Yeah.
I can say, yeah, it's external cephalic version, an attempt to manually move the baby into a better
Yeah.
position.
I really forewarn anybody to not Google it or to not YouTube it. Actually, don't YouTube it because I made that mistake and it was terrifying. But
Oh
it's like,
no. Good warning. Good warning.
yeah, yeah, they're literally manhandling your pregnant belly to force the baby to turn, and that kind of just threw me way off. And my OB kind of just nonchalantly says, like, "Oh, you should really be considering getting an ECV." And I'm like, "What does that entail?" And they're like, "Yeah, so we're just gonna give you some muscle relaxers to relax your uterine muscles, and then just turn the baby. And at that point, you have to be in the hospital because if the baby is under stress, then we're just going to pop you into the surgical room and get you an emergency C-section." Nonchalant, like, "No, we're just going to pop over to the pizza store and grab a slice."
Yeah, because they're trained surgeons. So it's like, oh, this is easy for me
Yeah,
because this is my specialty. That's
yeah,
often the thinking. And that
yes.
makes sense from that perspective. But if that's not what you're wanting, that's
No, it's
like,
not
no, thank you.
normal. Yeah, it's
Yeah.
not normal people thinking. So
Mm.
I was just like terrified. And then so I went down this Google hole and I was on Reddit forums, I was on Facebook forums, I was on medical journals. I was like, I went deep into this Google hole. I
I'm
learned
glad to hear the
that,
medical journal part. There
yeah,
was at least some like
you know,
studies or
yeah,
evidence-based stuff that
I
you were
didn't
looking
just,
at.
yeah, I didn't just base my findings on one single Wikipedia page or
Good.
that one Facebook friend that you're like, "Oh my, what Sharon says is totally law." No, so I really went deep here. And what I found was that it is so incredibly risky. I mean, I think success rate is only at 60%. And if you think about it, that's close to 50%. Like, I mean, I'm no
Right.
math whiz, but it doesn't seem like your chances are great there.
Yeah, and I will point out that some providers have much higher efficacy rates than others. And if someone's considering this, they could have a conversation with their provider about, do you
Hmm.
know how frequently is this effective?
Hmm.
Whether or not they'll have a statistic, I can't promise, but I definitely know that some of them are much more expert at it and have much higher.
Hmm.
Some of them have like 85% success rates. It just depends on
Oh,
the provider.
yeah, yeah. I mean, the way my OB said, she was like, "Oh, yeah, we have about 60% success rate, which is better than zero. So there you go." I'm
Sure.
like, mm,
Too
still
close
not,
to 50% for you.
still not sure. Yeah, still
Yeah.
not sure that's worth the risk. But the more research I did, the more I was like, that's not a great success rate. And do I really want to be putting baby under that much stress only to maybe have him flip back around? Because through, again, this hole that I was in a lot of the Facebook groups that I looked up, a lot of people who have gone through and gotten ACV, baby ended up turning right back around, or the procedure wasn't a success. And since they were already under a spinal tap, they were like, "All right, since we already have the OR booked, let's just get you a C-section because we don't know if baby is going to be under stress or continue to be under stress after this. And since we already have the OR booked, let's not waste
Yeah.
it."
Yeah. And I'll just point out, just to clarify, that most of the time an epidural is offered and even often recommended for this
Mhm.
procedure because it can
Yeah,
be so aggressive and
yeah,
potentially really painful for the
yeah,
parent, not just the baby, but for the parent.
yeah,
So that's what you're talking about.
yeah,
If
right,
we're
right.
already set up with an epidural, then we
Yeah,
can easily move to the OR if needed, because then we'll already have some numbness for that.
yeah,
Mhm.
yeah. And then so it's just like they force your hand there too to deliver prematurely and not have the birthing experience that you want. I just felt like all those things considered, it just felt like a lot for this big 60% success rate. And through that, I also found the Webster technique, which is done through a chiropractor. And I found the ICPA website, which gives you a directory of all chiropractors, I think, in the nation that are certified in the Webster technique. And what that does is, and I had no prior knowledge of anything a chiropractor does. I just thought they were like really intense massages. But in fact, I'm very wrong. But the Webster technique specifically focuses on certain points in your spine and your tailbone that kind of realign your pelvic positioning to better give that space to baby to turn around. And so I saw Dr. Mack in Floral Park, Queens, and he was just amazing. He is just so patient and he really takes time to explain everything to you. And like I saw him at 35 weeks and I'm like, help me because I do not want to get an ECB. I don't want a C-section. What can I do? Can I be saved? And he took a look at our first consultation and he's like, well, there are about 5 things of criteria that allow for us to apply the Webster technique. You fill out all 5. So we got to get started right away. I want you to come see me twice a week until due date. And so at that point, I saw him twice a week, every week. And 5 days before my scheduled C-section, the baby finally turned. And I was just amazed. I was amazed at the timing of it and just how it worked. Like, I just had no idea anything about the chiropractic world and how effective it is in this like much less intense, less stressful technique that they can use. And just the timing of it too, 5 days before my scheduled C-section. So they actually push you to schedule a C-section so that you have your OR booked. And so I had to have that scheduled C-section. I had already gone through pre-surgical testing and we were getting close. And so when he finally turned, I could have kissed Dr. Mack. I was just like,
sure.
I mean, it was just amazing. It was just an amazing feeling.
Would you mind sharing maybe just a few details about what the sessions were like?
Yeah.
My understanding is that it's not usually, a lot of people associate chiropractors with like aggressive cracking and stuff, but my understanding of Webster is that it's usually much gentler technique. They're absolutely not manually turning the baby. They're just trying to optimize, and I think you touched on this a little bit, but trying to optimize your body and your alignment to make space for baby to flip head down. But what were those sessions like?
Yeah, first of all, there's definitely no cracking at all involved, even with non-pregnant patients, because Dr. Mack, his office is very like open space type of layout. And so you're just divided by this, it's almost like a half semi-wall type of deal. And I heard him with other patients and there was no cracking. Like he's just a very gentle guy. He looks like Santa Claus. But anyways, so my sessions with him. So you go in, there's this donut shaped pillow for your belly. And you put your belly in the hole and then you lie face down and he focuses on specifically like the pelvic area. So like we're talking tailbone and like the bone that I guess your butt is. I don't like the 2 bones that your buttocks sit on.
The sit
I
bones,
don't even.
Yeah, sit bones or sits bones, you'll also hear.
Yeah. So he focuses on that entire area, the hips. So your belly is in this hole and then the table is a little bit risen. It's like on a riser. And then he presses down really hard. It doesn't hurt at all. He presses down really hard just so that the table then moves back down. And I think that's how he knows that that's hard enough. He doesn't need to go harder. If he's pressing down too light, he knows he needs to go harder. I think it's just a measure for him to know how hard to press. And so he presses down on those certain areas. I mean, the whole session takes 10, 15 minutes max. And so I went twice a week. And after the first week, I already felt a difference. I just felt my entire pelvic region so much lighter. And I think it's because baby was in transverse position for so long. I felt very top heavy. And so that was a lot of weight for like my lower back to hold myself up basically. And so I was feeling a ton of pain in my lower back. Every time I'd walk, take stairs, I really felt this like shooting pain. And so after that first week, it was just so much lighter and I could walk comfortably. And among the homework that he gave me was to go home and continue spinning babies exercises and walk. He was like, you got to walk 2 miles every day. I don't know if I hit 2 miles every day, but I certainly walked as much as I could around the neighborhood with my older son. And the yoga ball, which I learned from your class, is just the gift that keeps giving. It can be used as an exercise ball. and as like just pelvic exercises during pregnancy. And that was extremely helpful because Dr. Mack had suggested maybe try hula hoops or maybe just try like standing up and pretending you have a hula hoop. Basically, you want to have your pelvic area move in that round motion. And so I found sitting on the yoga ball, doing those exercises while watching a Netflix show was perfect. It was just perfect because you don't even think about it.
Yeah. Yeah. And as you're saying this, I'm sitting on a ball and I found myself like doing the circles as you were saying that.
Yeah.
And even not being pregnant, it feels so
Yeah.
much better because just
Yeah.
sitting still, so much of us sit so much of the day and we get so tight and we get achy, especially when we're pregnant. So
Yeah.
I love these tips for listeners.
Yeah.
I love that your chiropractor knew to give you the Spinning Babies resource,
Yes.
which I'll of course link in the show notes, and the yoga ball tip and the walking. These all make a
Yeah.
huge difference.
Yeah.
One thing I just want to point out, or maybe sort of theoretically observe, is when you were describing where he was touching and impressing, it sounded like in the sits bones
Pressing.
area, everything's connected. And there are these different ligaments and things in that region that often get tight in pregnancy. And so often loosening some of that region and those ligaments and things can make a huge difference. There's this sacrotuberal ligament is one of the things that often needs some loosening so that the tailbone can move out of the way to make room for baby to come head down and or come down into the pelvis in labor. So that's so fascinating. I love hearing those details.
Yeah, it's so interesting. I'd love to hear you talk to him as well. That would be so interesting. But
I have reached out to him because when you brought him onto my radar, I could not believe that I hadn't heard of him or met him yet. I'm working on connecting with him for sure.
Yeah. So the way he described it to me, and he's so good at explaining these things, the way he had described it to me at our first consultation is that your body is, if you just think of two ropes going down both sides of your body, what happens when this is not a medical term, but when you're out of whack, like what happens is you end up having knots along one side on one rope and maybe not the other. And so your pelvic bone is sideways or it's like crooked.
Tilted.
Tilted. Yeah. So his work is to press and work out those knots so that both ropes are straight again. And so one of the first things he does at the first consultation is have me lie on my back and reach both hands up. And at my first consultation, my hands were not on the same level. It was like totally crooked. Like one hand was shorter than the other. And so that's how he knew, like visibly, and that he could show me visibly that I had a lot of work that needed to be done. And what's interesting also is that he said, because I asked him, I was like, how did I get here? I know my posture isn't great, but what could I have done differently? And he's like, I've been seeing so many patients because of the pandemic and because of working at home. People don't notice their posture anymore. They're working with their laptops in all sorts of crazy positions. And you just kind of get into the habit of it and your body adjusts to that and you don't feel it. You don't feel it anymore until it starts to become painful. And he's been seeing a lot of patients because of that. And for me, I work remotely from home 100%. And especially now thinking back on it, nursing my first son for 13 months, exclusively nursing in all sorts of terrible, for me, positions. When you're nursing, I think you can lie down, you can sit up, you can be half lying down, you can be curled up, you can be in all sorts of weird positions. And the heavier that baby gets, if you think about it, you're holding this like 20-pound sack of flour. And like all that weight is just not evenly distributed whatsoever. And you feel it, your neck, your lower back. And I think as moms, we just learn to live with the pain and uncomfortableness. And, hey, we're not dying. Okay, let's move on. Let's go on with our day.
Who's got the additional time and energy? Yeah,
exactly.
Yeah, that's tough. And then on top of the things you're talking about, these repetitive movements and sitting too much and all of that and awkwardly working on our laptops and awkwardly breastfeeding. There's such a connection between the fight or flight response and the stress response and our psoas, which is intricately woven into our pelvis. And then that can get tight whenever we're stressed out, which everybody's been more stressed out than ever in the past 3 years, I feel like. So there's that component as well. And chiropractors are so amazing at addressing all of that and really helping our whole neurological system calm down and bringing us a greater state of not only alignment, but relaxation with regard to the whole vagus nerve and the vagal system.
Absolutely. Absolutely. And what's also great about Dr. Mack is he also focused a lot on getting me in a better mental state as well. He was like, and I love the way he phrases this. And I don't know if it's like exactly what he said, but at, again, our first consultation, he was like, the work that I'm going to be doing is focusing on the passenger, the passageway, and the mind. So what I can do is the mind. What he can do is the passageway. And what we need to focus on together is the baby. And like, he really encouraged me and my husband to talk to the baby every night. And he was like, I know this is going to sound crazy. Like, and I know it sounds way out there. You're going to think I'm some sort of hippie, but I swear to you, there are actual research studies out there that prove if you talk to your baby, you will start to see things move. And so it's very awkward for me because that's just not something, I'm not a very sentimental person to begin with. And for me, I was just like, who's got the time for that? Is this really doing anything? But my husband was like much more on board with it than I was. And he was like, all right, yeah, let's sure, let's give it a try. So every night we just maybe joked around with the baby a little bit too. It doesn't have to be like, oh my gosh, sweet baby, you're doing such a great job. Please turn, please. Like,
it could be reading anything or just saying anything.
Yeah, it would just be me and my husband having conversation and kind of including the baby and being like, what do you think about that? Or how about when you get here, you can decide what color you want or this and that. I don't think it needs to be like all lovey-dovey. So I think just the way you talk to your baby looks however you want it to look. And we tried that. I really followed Dr. Mack's homework because I really wanted this work. And I really do feel it did help with the stress and with kind of just letting go of the accountability of it. Because I think the moment you're pregnant, you feel totally 100% responsible for this tiny human that's growing inside of you. And a lot of times, complications happen and it is out of your control. It is not something that you could have done differently. And so I think for me, I easily spiral into, oh, it's my posture. Maybe I should have worked differently. Maybe I should be watching what I do, how I walk, how I sit, how I eat. Like maybe it's my fault that he's transverse. And so I think talking to your baby, really that important aspect of letting go of it being your fault or your responsibility, it helps tremendously because then you start to see this baby as, okay, they are like about fully cooked at this point and they have their own mind and they're going to do what they want to do. So you just need to let it go. And so that part really surprised me as well.
I love this. This is so great. I totally agree with you. And that really resonates. Awesome. Is there anything else that you wanted to detail or share about pregnancy, including chiropractic or anything else before you go into your birth story?
Yeah, no, I mean, I would just say, I think when you're pregnant and like myself, I had always grown up with my immigrant parents telling me how revered doctors are and how they're so knowledgeable and wise and they've gone to 15 years of school. They know exactly what they're talking about and you have to listen to everything they do and say. And I think while all that may be true, I think that in our generation, in our world right now, where you have this multitude of information at your fingertips, I would encourage everyone to do their own research. And I'm not talking about Sharon from that Facebook group. I'm talking about really doing your own research in the variety and diversity of ways that are out there. Whether it's a doctor doing an Ask Me Anything on Reddit, whether it's medical journals or other people who have gone through the same procedure or the same exact situation that you're in. This podcast, do your research, find information, because I swear it's out there, and come to the conclusion on your own of how you want to take your own pregnancy and your own approach to things into your own hands.
Excellent, wise words. Thank you. And something that came up for me when you were sharing that about your immigrant parents and Doctor Knows Best, we were having a workshop with our doula collective mentorship recently, and one of the people participating in the program she's a newer doula, but she has been a nurse in hospitals for over a decade, I believe, long time. And she was sharing how traditionally, many years ago and in other cultures, healers were healers because they were really excellent at what they do. But in our country, doctors can become doctors. They get accepted into medical school almost exclusively based on their test scores and their grades, not because they're necessarily going to have a great bedside manner or actually be good at what they do. Right. And I was like, oh, that's a good one. That's really good to sit with, that idea. And that is only one of many reasons that our U.S. maternal healthcare system is ranking at the bottom of the developed nations in its outcomes for birthing mothers and parents. And this overtrust of surgery and technology and interventions is another reason.
Absolutely.
And so good for you for doing, if you didn't want a potentially unnecessary surgical birth, good for you for doing the research, like you're saying, like you're encouraging people to do, to seek out other ways, to less aggressive ways, less risky ways to help encourage your little one to turn down, with that goal of the healthiest birth possible, and the kind of closer to the kind of birth that you were looking for and hoping for.
I mean, and don't get me wrong, like, I don't have anything against the C-section. I just wanted to make sure that I exhausted all efforts. Like, I done everything I could have in my power to turn this baby around. And hey, at the end of the day, if he never turned around, if he continued to lie, transverse, or breach, like, I would have been fine with a C-section, because at least I tried.
It would be necessary. But glad we have cesarean when it's absolutely necessary. But given that it's major abdominal surgery, we don't want to do it unless we really have to. Yeah. So great. Thank you for those wise words. Appreciate that. All right. So feel free to jump into your birth story wherever you want to start. In the last few, you said baby turned 5 days before, I believe, your scheduled C-section.
Yeah. So I was scheduled for a C-section at 39 weeks and I think 5 days. And at that point, baby turned, and then it was just a regular waiting game. Then at 40 weeks and 1 day, I had felt a little bit of a trickle, and I knew what that felt like, because my first birth, it was also, my water broke first, and it was definitely just like a trickle. It wasn't like the movies at all, where it's like you suddenly feel a gush, like a water balloon just broke, and you're like, of course, like in an elevator or something. It wasn't like that at all. It kind of just feels like, if I were to describe, like you peeing on yourself a little bit by accident from laughing so hard. Like, that's what it feels like. And so I knew that feeling because of my first. And luckily, that same morning, I had an appointment with my OB to get my 40-week ultrasound. And so at that point, I called my OB and I was like, hey, I think my water broke. I'm not sure. Do you want me to just come in for my regular appointment? Do you want me to come in now? Do you want me to go to ER or hospital? What should I do? And she's, no, come in. They have the tools necessary to test your amniotic fluid in the office to see if it is, in fact, amniotic fluid. And so I went to my scheduled appointment, did the ultrasound. Baby was still head down. Hallelujah. And it was, in fact, my water. And because I have group B strep, my doctor was like, you need to go to the hospital. And also, on top of that, you're 3 centimeters. I was like, what? I had no idea. Literally no idea. I think because I have a toddler on my hands at home already, things are just crazy around here. I had felt contractions on and off. It was definitely not coming in regularly. I just felt contractions here and there throughout the weekend. And by Tuesday, I mean, we're talking like 3 full days here. By Tuesday, I had gone up to 3 centimeters. So she was like, "You're 3 centimeters, you got group B strep, you have to go to the hospital." And I was like, "But could I just maybe go to Shake Shack first and then go to the hospital? Do I have to go to the hospital right away?" And she's, "It's your risk to take, but I would suggest, yes, you go." And then so my husband, he is very a nervous person. And so he was like, "But if she says that, maybe we should go." I'm like, "But Lisa said we don't have to go right away."
Go through a drive-through at least. Get a meal.
I know.
Shake Shack sounds really good.
They give you so much crap at the hospital for eating. Like literally, while after we got to the hospital, they would come and check and be like, "You didn't eat anything to do." It was like you're in detention or something. Once we got to the hospital, I was starving. And at that point, like I hadn't eaten anything since the morning. And by then it was like, what? Like by the time we did all the paperwork, got a bed, it was like 3 o'clock in the afternoon. And I was starving. And my husband had to like go to the vending machine, get onion rings, like Funyuns, and sneak them to me.
Like, I ate so many Funyuns in junior high school. Flash from the past.
I mean, they
still sell those.
They still do, and they taste extra delicious while you're in labor.
When you're starving.
Yeah. I like had to like basically sneak in Funyuns, Doritos, like I just anything he could get his hands on at the vending machine at the hospital. And so I was really kicking myself for not going to Shake Shack first. And even though I have group E strep, yeah, but it's not. I mean, I think my OB kind of just wanted to rid herself of any liability, basically. "Hey, I'm telling you, you have group B strep and you do what you will with it." And I just felt like that wasn't very supportive because to me, I just want a friggin' burger.
And like, how long is that really going to take?
Yeah.
Seriously? And so many of the times, like people rush to the hospital for this scenario for induction or things like this. And then they get there and they wait for a room to start an induction 12 hours. And I'm like, that means it was not entirely an emergency, but okay.
I know. And the way like for that split moment when we were deciding whether or not we should go right away or wait a little bit, for that split moment, I was like, "Oh, maybe she's right. Maybe I do need to go because group B strep means that you have that bacteria. And because my water has been broken, maybe that bacteria will get up to baby and whatever." You just start spiraling and thinking worst case scenario. And I think in the grand scheme of things, yeah, it could have waited like that 20 minutes while I go on a detour and get a smoothie and a burger. So I'm really kicking myself over that. And I highly advise anybody in the same situation to just go get the burger. So I get to the hospital, eating Funyuns, eating Doritos, like whatever I can get my hands on. And the hospital, the labor and delivery floor is packed. It's packed. I mean, this is 2 weeks before Christmas. And it was just packed. It's as if people were it was like Macy's Herald Square. Like it was crazy. And we were still just in the triage room with there were 2 other women in that room. So it was a room of 3 beds. And the light above my bed wasn't even working. It wasn't even working. And it was like dark. There was like flickering lights. It was just like a bad situation. And it wasn't until another 6 hours go by that we could have finally gotten to bed. And so it was just packed during that time. So given that, how packed it was, I think that they had this fire under their butts to start turning over beds, more so than usual, probably. And so about 2 hours after I get there, a PA comes to check on me and she's, "Yep, you're still 3 centimeters." And I'm like, "Yeah, I know that. I was just checked 2 hours ago. Like, how fast do you think this is going to move?" Obviously.
And hello, why are they doing another internal exam when they just did one when there's a greater risk of infection because your waters have released? What? Seriously?
Yeah. I honestly think it was part of the show to be like, hey, oh my gosh, you're not dilating fast enough. That was for them to lay out the groundwork to be like, you need Pitocin. That kind of felt to me as that was the end goal for them. And so at first they gave me Cytotec, which I know to be like baby Pitocin. It's like to help things soften up, move along a little quicker. It's not as intense as Pitocin, as I understand it. And so I took the Cytotec, not much movement. And from there, it was another, I think maybe only not an hour-ish, an hour, 2 hours. And they were like, okay, you took the Cytotec, it's still not moving. We're going to give you Pitocin. And I was like, hold on. Can you just give me some more time? Like I just finished it. Like, what do you want me to do here? Can you just give me some time? And they were like, all right, fine. So they held them off that first time. Second time, about an hour later, again, they're like, okay, still not moving. We're going to need to give to you now. And I'm like, can you please give me some time? And the second time, I held them off for half an hour. And then third time, I guess they maybe like, maybe they like labeled me as a difficult patient or escalated my situation. A nurse manager came and talked to me, and she's this woman in her 70s. And she's, listen, honey, this isn't the 80s where we don't know anything about Pitocin. We've been giving Pitocin for decades now, and it's totally safe. It's totally fine. This is only to help you. It's only to help you and your baby get here safely because you have group B strep. And because of that, potential infection can happen.
But you're getting antibiotics, right?
Yeah.
Like, yeah. No risk to Pitocin either. That's ridiculous.
I know.
I'm so sorry.
I know. They were just like using whatever they could at that point. Like it really just felt like me against an entire floor of nurses. And so it was just extremely not like hostile, not supportive. And at that point, I think I was just tired. I was hungry. I was tired. It wasn't even from labor pain. I was just overall tired. And I knew that I couldn't, like, I knew that, like, I couldn't fend them off anymore. I'm a very non-confrontational person. I don't like conflict. So for me to have spoke up those times that I did, like on my own, I think is as much as I could have done. My husband, I can rely on him to say something, but he is like either 0 or 100. Like the last thing I need is for him to get dragged away by hospital security. So I'm like, you know what? Let's just leave it as it is. If they want me to get it, fine. You know what? Fine. And at that point, I think it was around 6 hours since I got to the hospital, which also again isn't very much time. And so I decided to get an epidural before I got the Pitocin, because lesson learned from my first birth is if you get Pitocin first, things start moving very quickly. And then by that time, like you're like white knuckling, waiting for the epidural to come. And so I had gone into this birth like I did my first, where I'm just, you know what, let's see where things go. I'm not giving myself any sort of set expectations. I want an epidural by however many centimeters, or I do not want an epidural at all. I have just went into it thinking I'm probably going to get one, but if I don't need one or if I don't feel like I need one, then I'm just going to try and ride it out. Let me try and see like how far I can get. And it was just sucky that I didn't get to really let myself experience how far I could go naturally. And so I got the epidural first, and then they gave me Pitocin. And then from there, it happened all very quickly. Within 5 hours, my second baby, Ira, was born at 10. And yeah, it was just crazy how everything happened. And even up until the point that I was fully dilated, at that I knew because I felt that intense pressure. And as he started coming down, like the pressure, the rest of my sac broke and I felt that gush. That is when I felt that gush. And it's kept with every contraction. like more and more kept on coming. And I told the nurse, and she was like, "Oh, it's because you're lying on one side for too long. Like, it's the medication that's leaking out. Like, you need to." And I'm like, "What? That makes no sense.
What? Yes,
What?
what?
Yeah, what
Which
medication?"
medication?
Yeah, yeah. And she was like, "It's because you're lying on one side for too long. You need to flip over it." And then, and I was like, "Why?" She's, "Yeah, it's all the medication leaking out because you're a physician." And then she proceeded to blame me for lying on one side instead of my left side or whatever. And
Mm.
it was just bad. And then it wasn't until she was like, "All right, fine." She like reluctantly said that she was going to call over a PA. PA comes to check on me, and I see hair. I see hair. I gotta call the doctor right now. So this is what I've been trying to tell this nurse this whole time.
Can
And like,
somebody send that nurse back
yeah,
to like communication skills training, please?
oh,
I'm so
it was
sorry you
bad.
were treated
Yeah,
that way. Listen
yeah,
to people in labor when they
exactly,
say they know their body better than
exactly,
anybody else, please.
exactly,
Right?
exactly,
Oh,
exactly. And yeah, and then so from there they called the doctor, and then from there it was just like it was easy peasy. Couple pushes, and he was out. Mazel tov.
this
And
is our second or third
yeah,
or fourth,
yeah. I
usually,
think at that
generally.
point, yeah, I think at that point, my body was like, "Oh, we're doing this again. Oh, it's not your first time at the rodeo." Oh, yeah, that was, I would say it was a wild ride, to say
Well,
the
and
least.
yeah, I just want to commend you for buying yourself time for the several rounds that it sounds like you did. Did you just think to do that, or did you remember it from taking birth class, or how did that
For sure. Yeah,
come
for
to mind?
sure. Like, I would say that taking your class really helped me to give me that voice, because if I had not taken your class, I would just be where my parents taught me, listen to whatever the medical professionals have to say because they're all knowing. And because I took your class and because I learned through that there is another way, and there are a plethora of options and information out there, that you have to take your own experience into your own hands. Like, you are the one birthing here, not them. And so I think that really helped me at that moment to say, this isn't how I want it to go. And I do want to wait. This is something that is important to me. And if it's important to me, then I have to say something about it. And I think I don't regret not pushing back more, because I think that also, again, me being non-confrontational, if things had gone to the point of like being contentious, that would have also stressed me out at that point. And I think that's where a doula would have stepped in. I chose not to get a
Mhm.
doula. And I think in those type of situations, a doula would have really fought for you. And I
Mhm.
would say that absolutely, hands down, that is the importance of having a doula, so that she can, or he can be, that voice for you if
Mhm.
that is absolutely something that is non-negotiable for you.
Mhm. Well said. Thanks
Yeah.
for sharing that. Did baby come straight to your chest after birth? Or?
Yeah. Yeah, he did. And it was just a really beautiful experience, because I think the second time around, I'm able to enjoy it a lot more. I think the first time, all of this is new. And so I think oftentimes you see on Instagram and social media how beautiful those first moments are. And like the moms are crying and it's, oh my gosh, love at first sight. But for me, and I think a lot of other moms out there, it wasn't like that. It was like, he came to my chest and I'm just thinking, oh, like he's so gooey. Like, what is
Uh-huh.
this like white stuff on him?
Oh, that vernix.
Yeah, yeah. And I'm just like, oh, I'm just like, and I'm sweaty. He's gunky, and I'm just like, I'm just like cracked out on epidural too. I don't think like people really warn you about like how that can make you lightheaded as well. And it was just like, and it was just like a weird experience. It wasn't like magical. It was just, I just felt like instant anxiety. And I felt like this is like a strange being that is put onto me. I did not feel love at first sight. Yeah, I think with my second, especially knowing that this is going to be my last as well, I think that makes the moment so much more special, because knowing that this is for me, going to be the last time I'm going to experience this. And because I know what to expect, I'm able to be more present and in the moment.
That's beautiful. And I'm so interesting that you shared that about the first and not feeling that magical. I'm in love because
Yeah.
that's been a theme actually on season 3 of this podcast. It's come up more than once and I've talked about it. The longer I do this work, the more I see that not every, more often than not, I feel like with a first birth, that is the case for many people. And too many people feel guilty if they don't feel like deeply connected and in love with their baby when they first meet them. But the way
Mm-hmm.
you described it is so poignant and makes so much sense. This is brand new, and more often than not, the weird word I hear described, like in those initial moments of meeting a first baby, is relief. And who is this alien like looking
Yeah.
thing that I've never met before? I don't really fully know you yet. It's going to take time, and it just makes so much sense. It does take time for most of us to grow into that feeling of connectedness and to just adjust to this metamorphosis you've all just gone through being a parent for the first time, whereas you're
Not
able
to
to enjoy
not
it the second time
Yeah.
more.
And not to mention, there's just so much going on in that moment. Like, there's this like, okay, you feel the baby come out, and that really feels like a physical relief. Like, you really
Mhm.
feel like you feel him out of you, and it's the only way I can describe it is you just took a very large poo, and then suddenly they place him on you, and you're like, oh my gosh, it's finally over. Okay, but now he's on me. And oh, in the meantime, like your legs are still wide open. They're stitching you up. Oh, in the meantime, all the lights are still like blasting in your face. Like, it's just a lot going on. And then like you have the nurse coming in and suctioning the fluid out of baby's like throat or mouth. And it's just, and then maybe your husband trying to take pictures. It's just, there's a lot going on in that moment. And so it's not like this beautiful spotlight moment that you're like, oh my gosh, and you start hearing like the angels sing.
I occasionally hear that from people, but that is
Yeah.
not the far from the most common thing
Yeah.
that I hear.
Yeah. Yeah. So don't believe everything you see on social media.
Right.
Yeah.
Oh, well, this has been wonderful. Is there anything else that you haven't gotten to share yet that you'd like to share, and or just final themes or tips or insights you'd like to share with expectant parents, first timers, or maybe people who are about to have their second?
Yeah, for sure. I mean, I would just say that, like, for me, I touched on this earlier. It's not that I'm against a C-section by any means. I think that in this day and age, in the intranet era, it can be so polarizing. And I think when you have a medicated birth, you're you yourself see yourself as weak, or you feel you're judged by others as being weak, whether or not that's a C-section or a vaginal birth. But then on the other hand, if you have a non-medicated birth, it's wow, you're a hippie. I
You can't
feel
win.
like you can't win. And I don't think pregnancy and birth can be put in a box. And I think it's so easy for us when we are down these internet holes and social media. You see all these beautiful moments of either camp, and you're like, oh, I belong in this camp. No, I belong in that camp. It's like, sometimes like you're not in either camp, and that's okay. And I think that's exactly the situation when it comes to pregnancy and birth. Like, everyone's journey to pregnancy is different, everyone's birth is different, every baby is different. The pregnancy and birth are just the tip of the iceberg when it comes to actually raising a kid. And so I think that I would just say, if I were to tell myself this or give others a piece of advice, it's just zoom out a little bit, have that perspective, and just know that every journey is different, and we need to give each other that grace and be more understanding of how people got to where they are. And I think I would hope that my story helps and resonates with somebody maybe who is experiencing similar feelings or also has baby in transverse position. I think what the biggest lesson that I learned is just to let go of that control, and also just to see things as they are and experience them as they come, rather than being like, oh, I have to have my birth this way or that way. is, I would say, the biggest lesson I learned.
Yeah, those are such wise words. And I don't know if you remember, we talk about in birth class that very
Mhm.
concept of let's set some strong intentions for whatever you prefer and are hoping birth will look like. And then once you set those strong intentions, really go into it with a good degree of surrender and
Mhm.
openness because it's going to protect your mental health. There
Yeah.
should never be, no one should ever feel ashamed or like they failed in birth if it didn't go 100% according to plan. All birth is birth,
Yeah.
and no one should ever be made to feel in our very polarizing social media landscape
Yeah.
as if we have failed because there are so many things that are out of our control. So I really appreciate your sharing that. Yeah, that's great,
Yeah.
Tracy. All right. Thank you
Yeah.
so much for taking the
Thank
time. It's
you.
so good to see you again on the other side of everything that has happened since you took class right before the pandemic with me.
I have so many friends that I know that have taken your class. Like, it
Really?
wasn't even like it was like later on after they've had their baby. They were like, "Oh, I took this really helpful birth class." And I'm like, "Wait a second." And then we realized that we all took your class. So it's just
Oh,
been extra special.
oh,
And
that's
it's such a pleasure to be able to talk to you again.
thank you so.
Thank you.
All right, so that's Tracy's story. Today, I will elaborate on just a few quick things: transverse fetal position, ECV or external cephalic version, other things that can be attempted in addition to chiropractic to encourage a baby to flip, and just a bit about the induction medications Cytotec, Cervidil, and Pitocin. The term transverse lie refers to a baby's position in utero being sideways instead of head up or head down. It's very common for babies to be transverse earlier in pregnancy, but usually by around 29 or 30 weeks, we see that most babies will turn to head down. The term for this is cephalic, or sometimes head up, also known as breech. If a baby's head isn't down by 30 or 31 weeks, this is a smart strategic time to start some proactive measures if someone would like to try them. I'll link to some of these strategies in the show notes. Today, you heard about chiropractic as one option. Folks also often see success with spinning babies, specific positions and movements, or acupuncture or craniosacral therapy. If you listen to the previous episode, I interviewed a craniosacral therapist. Although we talked about other benefits, not specifically about CST having potential to help flip a baby. We've talked about some of these efforts in past episodes of this podcast, including, in particular, episode 74. I'll add that Webster is not only great for anyone in pregnancy, but is also designed to beautifully support newborns, too. You can hear more about this in episode 102. And if this episode piqued your curiosity about the Webster technique, I've had a couple of Instagram chats with Webster certified chiropractors who are based here in New York so that you can hear more details straight from the experts who practice this technique. All of these episodes and Instagram chats are linked on this episode's show notes over at birthmattersshow.com. If a baby can't seem to reposition from transverse position, this is truly a medically necessary C-section birth or belly birth. Because if you think about the physicality of it, there's literally no way a baby can fit sideways through a pelvis without turning. In case I made it sound like a C-section is 100% necessary if a baby is breech in this episode, though, I just want to mention, as I've mentioned in past episodes, that breech babies could be born safely vaginally, but the sticking point here is that this can only be done safely if a provider has been trained and is expert in specifically breech vaginal birth. This is not the vast majority of OBs or midwives in our country, which means that with most providers, it will be safer and necessary to give birth via cesarean. Also, in today's show notes, I'll link to some info on the evidence as well as the pros and cons of external cephalic version, also known as ECV. If a baby is in breech or transverse lie position by 37 weeks, that's when an ECV or manually turning the baby could be done if someone wanted to try it. Discussions about ECV would usually start with a provider in the weeks leading up to that. I wanted to clarify that Cytotec is a synthetic prostaglandin that's often administered for induction either vaginally or orally. It's kind of thought to be a pre-labor ripening of the cervix medication. Tracy called it baby Pitocin, I'm guessing mainly because it doesn't usually create the strong, productive contractions that Pitocin does. It can create some contractions, but most people either don't notice them or if they notice them, they're not painful. Cytotec is cheaper as well as more powerful than the other prostaglandin used in the US, which is called Cervidil. So it's much more commonly what hospitals stock with if they're only going to stock with one of these medications. Cytotec can also be used, as can Pitocin, if someone happens to be bleeding too much after birth. You'll also hear Cytotec referred to as a tic-tac because it's a portion of a pill to be the proper dosage, or another term is miso, not for miso soup, but for the other name of the drug, misoprostol. It was originally developed to treat stomach ulcers and is used off-label for use in inductions and after birth, so that's why it's necessary to portion the pill, as a full pill is too powerful. Regarding the other drug Tracy mentioned that's used in almost all inductions, Pitocin doesn't necessarily hit everyone fast and hard immediately, even though this was true for Tracy. The medical staff started at a very low dose the vast majority of the time and are supposed to very slowly, conservatively increase the dosage over time, only to the minimum amount needed to create productive contractions that help labor to progress. Okay, in our next birth story episode, we have a couple of birth class students of mine who had a home birth with 2 doula alums from our collective supporting them. The birthing parent, Shada, has become a doula since giving birth. Here's a sneak peek.
Prenatally, I was really into hypnobirthing and trying to prepare myself to relax and surrender, which is totally not how labor went for me at all, which I'm glad to know. And then in your class, you said you don't have to like it, you just have to do it. When you said it in the class, I was like, oh, I like that. And I think that attitude more carried me through than trying to surrender.
As we close things out today, I would just ask you, if you have not already followed us or subscribed to this podcast, I'd be so grateful if you would. And if there's an option to review where you're listening, maybe just leave a quick review as well. That will help other expectant parents find us. Thank you so much for listening to the Birth Matters podcast. We'll see you next time.